Okay, I wanted to talk about compressing the time frame of healing. In this previous slide, you saw the pictures about the injury, the crutches, the medicines or pills, aspirating or putting a needle into somebody's knee, and then physical therapy. I think all these keys are important, but you have to understand the concept of why this all helps. Um, let's just break down an injury into the injury event itself, stabilizing the injury so there's no further damage, repair or initiating repair, and then return this to the previous activity or sport. And you can effectively shorten all four of these phases. The injury, you would think that an injury is an injury, but you can actually think preventive. If you're in a sport and you have poor flexibilities, for example, and a lot of my golfers won't like this, but golf and back pain. You certainly don't want to be golfing with a big belly or a weak back or a painful back. So by the same token, if you have a problem with a painful knee and you decide to take on a marathon, probably not the wisest thing to do. If you have repetitive problems with iliotibial band syndrome and you want to go bike riding, or you want to take on a 100-mile bike ride at the end of the year, I would probably do as best as possible to see a doctor, see a sports medicine doctor, see a physical therapist to get rid of the IT band problem before starting the activity. So preventive education before the activity is very important. If you do get injured, it'll hopefully shorten the injury or shorten the intensity or severity of the injury. So knowing about your sport, knowing about your basic deficiencies, knowing about flat feet if you do have flat feet, or recurvatum to the knees, also called sway back knees in dance or gymnastics. Knowing all that helps with developing or getting a program together to strengthen yourself specifically for the sport. Same thing with the equipment, and I'll speak of that later on, or at least I'll show it in the PowerPoint presentation. Going into very active endeavor with poor equipment, poor shoes, bald tires, you're asking for trouble, so you really have to spend the money for the equipment once you decide to embark on going deeper into the sport. The stability wise, stabilizing. I showed a slide earlier on with an ACE compression or a knee sleeve. The best knee sleeves are the ones that compress the knee so that the synovium, that potential space that fills up with fluid, if there's no space to fill up, then the oozing, the bleeding will stop, believe it or not. You won't be able to get any more blood into the compartment, that synovium. So there's a toss-up between compressing and compressing the synovium flat, and also compressing the kneecap into the femur, or into its the place that it rides too hard. If it was already under friction and you put this tight knee sleeve on to compress the sac, but yet the kneecap is pushed down even further, it's going to cause more pain, more inflammation, and more accumulated fluid. So as you'll notice in that slide, the best knee sleeves are the ones with a hole cut out in the center. That's a patellar cut, if you can find them. If you can't, and wherever you are is just limited, then the best thing would be an ACE wrap. And again, you ACE wrap from the distal extremity to the proximal extremity. So if you have an injury to the elbow, you wrap at the forearm and wrap it to the shoulder. If you have an injury to the knee, you wrap from the calf up to the thigh. You want to push fluid back to the heart instead of pushing it down to the foot or the fingers. So that's always key. And some people asked in the lecture, how tight is right? It's really a matter of preference. You really have to have it snug so no fluid accumulates, but you don't want it too snug so it, again, compresses the kneecap, or where it cuts off blood flow to the fingers or the toes. or it causes more swelling to accumulate. You don't want that. So, worst case scenario, you just unwrap it if it gets numb and tingly and rewrap it a little bit snugger than before. There are knee immobilizers that we give in the emergency room. They don't do anything for compression. They just keep the knee totally straight. And really, they're supposed to be used with crutches. If you're that bad that you need a total knee immobilizer, you really should be on crutches too. I know a lot of my patients decide not to take any crutches. They'll just walk kind of like a one-legged or a pirate, and that doesn't work. You're still putting pressure on the kneecap. You're still firing off the muscles, and you're slamming the kneecap every time you fire off the quadricep muscles, the quads. The kneecap gets pulled up, and if it's already irritated and it gets pulled up even with each step, then you're causing more damage and you're not stabilizing the injury. So it's very important to use crutches, very important to use knee sleeves properly, and ice. And it's also very important to use medicines. Anti-inflammatories are very good, but they have to be used on a regular basis. If you use Motrin just when you're in pain, once, twice a day, you have a portion of the day that your Motrin isn't working or it's dissolved and you have no inflammation control. So Motrin, ibuprofen, Advil, they're all the same. Naproxen, Aleve, those are both the same. They have to be used on a regular basis. Usually Aleve is about 3 times a day, Motrin's about 4 times a day. So the downside with over-the-counter anti-inflammatories, which are great for controlling swelling from the inside, the downside is that you have to take them so often. At least do it until you get in to see your doctor. If you get injured on a Saturday, doctor's office isn't going to be open until Monday, so you just keep on with the over-the-counters, the icing, the compression until you see your doc on Monday, hopefully. Which brings me to another point. The problem with compressing the time frame, if you're injured on a weekend, some doctors don't have available appointments on Monday, so you don't get in until maybe Wednesday, Tuesday. And by that time, you've already accumulated 4 more days of further injury, especially if you had to go to work or you're in a job that requires a lot of labor. So that's why it's important to be in contact with your physician's office, or at least to know one. If you don't have a physician and you try to get one, good luck. Usually the docs at the emergency room can help, but they only stabilize, and some of them are not that good with sports medicine. They can stabilize injuries, but they don't know the dynamics of sports medicine and quads and how to get people and athletes back into the swing of things or into rehab quickly. So it's always good to know a doc beforehand. If you don't, then again, rely on the medicines until you can get the good prescription medicines, which are sometimes once, maybe twice a day. If you don't like medicines, then I know they're very good. I love using herbs, supplements. Turmeric with piperine, very important. And the reason pepper or piperine is important is most of the studies. Janet Funk just recently did a nice review of turmeric with and without pepper, and found that the patients that used turmeric and pepper together had better results in controlling inflammation in the long run. So it gets absorbed, it pulls it into the small intestine and gets it into the bloodstream faster than just turmeric by itself. Glucosamine sulfate, excellent supplement. You can save yourself some money. Many studies now are coming out that show glucosamine sulfate used in a 30-day burst. If you hold for 90 days after that 30-day burst, it'll still continue working and giving you a great range of motion in a arthritic joint. So the bottom line is that 30 days, once a season, is good enough to have the glucosamine sulfate continue with its effects on the lining of the cartilage. Usually it's about 1,500 milligrams a day. There's also magnesium at high dose, maximizing on vitamin D, and then omega-3 and multivitamins. I will have a slide later on showing the anti-inflammatory diet, and even if you do eat properly, it's sad to say, but the standard American diet is poor. It has high omega-6 to omega-3 ratio, so it's pro-inflammatory. So if you get injured and you're already inflamed or turning on the inflammatory response, by indulging in a bad diet, you're just adding fuel to the fire. So I urge my patients that are injured to really change the diet during the time that they're injured, and then get back to the crappy stuff afterward. But hopefully you'll feel the effects of eating properly, and how fast the healing time improves when you do eat properly. And watch what my teacher Andy Weil has to say later on in the slides. Two more points. When I see people that are in the office and the knee is obviously hot and swollen, I'll take fluid out to help with the pain. I'll also take fluid out to determine whether it's golden, which is inflammation, or red, which is bloody and traumatic. Whenever we have bloody or traumatic, as I mentioned in the first video of the PowerPoint, it could be an ACL, a meniscus tear, fracture, or a patellar dislocation. Those are not good. But for the most part, when we take fluid out, I offer to patients after they feel great to put steroids back in to stop the reaccumulation of fluid if the inflammation is still fresh. That's totally up to the patient, and sometimes it works fantastic. Most of the time, it works great to hold and control the discomfort afterward. And once we control the discomfort, once we stabilize, whether it's with taking fluid out, whether it's with an herb, whether it's with an anti-inflammatory, the objective is always, always, always get into therapy. Even my athletes that are very gifted with their knowledge about what to do and previous injuries and exercises, I think it's always important to have an outside set of eyes tell you that you're doing it right, your muscles are firing off properly, or this is a better way to do it. It's always hard to work against your knee that's saying it's in pain. It's hard to push yourself to the right point. Some people push too hard and they get re-injured. Some people don't push enough because it's too painful. That's where a physical therapist comes in very handy. And again, whether you're a weekend warrior or whether you're an Olympian, I've used physical therapists for the gamut. When I worked with Cirque du Soleil, most of the Canadian performers were ex-Olympians. And even though they knew what to do, if any of them got injured, I would always get them right into physiotherapy, because these people had to perform. If they didn't get into the show, they don't get paid. So we wanted the show to go on, and we wanted people to get back to normal fast. And the good thing about my Olympians at Cirque was that they knew when they didn't wait for the full injury to blossom. They knew when there was something that was starting to show its head, when the pain was starting, and they got into see me, and then we got them into physical therapy immediately. If you don't have that option, again, knowing an exercise physiologist or a personal trainer might be good. Sometimes the quality, it's harder to find a good one, whereas with physical therapy, it's controlled by your board of medical examiners, so you have to jump through a lot of hoops and prove that you did the proper training. So don't be surprised if I send you to physical therapy, or if your doctor sends you to physical therapy, or even goes through all those steps. The idea ultimately is to compress the time frame of you getting back into the swing of things, or even just getting back into work. So hopefully we will help you with that, at least empower you with the knowledge of what to expect when you go to a doctor.